The current daily average of new cases stands at around 113,000, while the 7-day moving average for deaths is at 1,100 daily, with trend lines indicating a surge in cases, but not necessarily from the new Omicron variant.
In reported cases thus far, most people experienced only mild symptoms, which is what we would expect from a group of fully vaccinated individuals. This initial look at case characteristics is a starting point. We will continue to closely follow this variant to learn more about clinical severity, transmissibility, and susceptibility to our therapeutics and vaccines. Although we don't have all the answers on the Omicron variant, initial data suggests that COVID-19 boosters help to bolster protection against Omicron. And we should remember that still over 99% of cases in this country right now are caused by the Delta variant, which is driving increases in cases and hospitalizations.
Public health experts say the rise in death is being driven largely by unvaccinated people who continue to populate hospital and ICU beds, with CDC data showing that unvaccinated individuals are 14 times likely to die from COVID-19 than their vaccinated peers. And with holiday travel approaching, concerns infections will again explode, with only 60% of the population fully vaccinated.
We know the right things that we need to do, and we're asking people as they think about their holiday travel to really do all of those things to protect themselves and their family. So what is that? That is making sure you're fully vaccinated and boosted if you're eligible for boosting, getting your kids vaccinated, making sure those people who you're gathering with are vaccinated, ensuring people are practicing the proper prevention and mitigation strategies, including masking for at least a couple of weeks before they come together. And if you want that extra layer of reassurance on top of all of those prevention strategies, take a test before you gather and make sure everybody together is coming together with a negative test.
And while Omicron is expected to reach parity with Delta in driving infections in the United Kingdom this week, it currently accounts for less than 3% of cases in the United States, raising questions about when travel restrictions on southern African countries would be lifted.
What we are doing currently right now is looking at the evidence that would get us to pull back on that. And the CDC will be doing some modeling studies that they literally have started already to determine what the risk of increased influx of patients, balance of individuals who are infected, balanced against the already existing infection in our own country. So the bottom line of what you're saying is that we would like to lift that as soon as we possibly can, based on evidence that we can use as the basis for that lifting.
Dr. Fauci also indicating that their modeling of the dynamics of Omicron infections in the US could inform their decision on travel restrictions within days. According to a Reuters analysis, over 450,000 people died in the United States due to COVID-19 complications in 2021 alone, representing 57% of all deaths since the pandemic reached the country in late 2019. And while the tools are widely available to limit infections, but largely prevent hospitalization and death, the politics of this pandemic, from mask wearing to vaccines, continues to undermine what the science has long been clear about, that vaccines are safe and work, and are more often than not the difference between life and death. Sherwin Bryce Pease, SABC News, New York.
So here in South Africa, we're dealing with unprecedented cases, infections due to the new Omicron variant. Nearly 24,000 infections are reported in the last 24 hours. But we're bringing you a global view tonight. As you heard from Sherwin there, Omicron is spreading in Europe, but it accounts for a relatively small number of cases in the United States. Then, of course, the very good news announced tonight, the lifting of the travel ban seems to have begun, with the UK announcing announcing we will be off the dreaded red list from tomorrow. We are joined by Sherwin Bryce Pease in New York and Giles Gibson in London. Thank you both, gentlemen. Let me start with you, Giles. We had hoped for sooner. Many believed that this travel ban shouldn't have happened in the first place. What is the UK government saying about its decision to lift the ban or take us off the red list now?
Well, when they brought in the red list again just a couple of weeks ago at the end of November, the argument that the UK government were making is that they were simply trying to buy time before this new variant Omicron could seed itself here in the United Kingdom. But over the last couple of weeks, just so many cases of this new variant have been identified here in the UK. It's already at around several thousand, that it is now, the UK government say, just not much. There's not a lot of point having these travel restrictions. They're saying that they are less effective when you have such a massive community spread of Omicron. Having said that, they are lifting taking these countries off the red list, but the UK Transport Secretary Grant Shapps is still saying that the testing requirements for arriving passengers from all over the world will stay in place, and the UK government are also leaving the door open, really, saying that they could bring in different measures, tighter measures again in terms of travel if it is deemed necessary. And there is also just this open question at the moment as to what's going to happen to people who arrived here in the UK from South Africa and these other countries that were on the red list, who are currently in a hotel quarantine that has set them back several £1,000s. The Health Secretary Sajid Javid, speaking in Parliament earlier on, said that he is seeking urgent advice about this question about whether these people should be allowed to leave their hotel quarantine before their 10-day period comes to an end.
Yeah, presumably they won't get refunds. So very quickly, Giles, then from tomorrow, what do you need to get on a plane to land in the UK? And we are desperate for UK travellers that haven't been able to come. What do they need to get on a plane to come to South Africa?
Yeah, so as of 4 o'clock in the morning, UK time, local time here in the UK, the red list is scrapped. So if you're travelling from South Africa, from Nigeria, from Zimbabwe, and these 8 other countries that have been put on the red list at the end of November, then you no longer have to go through that hotel quarantine. There are still, as I was saying, some of those other measures in place, such as filling out the passenger locator form and also booking the required tests. This decision by the UK government has certainly been welcomed by the UK travel industry and travel industry groups who are saying that they're very pleased with this decision, but they are also calling for the government to go a step further and to not only scrap the red list, but also get rid of some of these testing requirements, which of course can run into a lot of money for a traveller having to book different PCR tests and that kind of thing.
All right, Sherwin, so you were explaining that Dr. Fauci is talking about the modelling that still has to be done. And of course, it's a different scenario in the US where Omicron isn't so widespread. I guess we can just hope that the UK has set an encouraging precedent here.
Francis, we're certainly working hard to read the tea leaves from what Fauci says, from what Dr. Walensky, the director of the CDC, says. Earlier this morning, she tweeted updating their latest data numbers, and they're saying that their genomic sequencing in the United States now shows that Omicron is representing about 3%, 2.9% specifically of new cases in the United States. So Delta is still at around 97%. When you talk about the daily average of around 113 new cases, remember in the context of this entire discussion that there's still about 60 million Americans that are not vaccinated. And CDC data is showing that in places like New York City and New Jersey, once the epicenter of this virus, of this pandemic in 2020, you are seeing Omicron representing around 13% of new infections. So numbers are going up in the United States, but certainly not quite at the level we are seeing in the United Kingdom today. When Fauci talks about the modeling, they're looking at things like how quickly is it accelerating in terms of Omicron? What are the transmission rates? What are the number of cases on a day-to-day basis? And that will inform them in terms of making a determination when and how the travel restrictions placed on those
8 Southern African countries could be lifted. We are not there yet. They are looking at data on a day-to-day basis, but they have not reached that determination yet, Francis, because they simply don't know yet quite how widespread Omicron is. Numbers are low, but they're rising in places like New Jersey and New York, in places like California and Washington State. And that, I think, could be determinative of when they finally make a decision as to whether the travel restrictions on those countries remain in place or get removed in the near future.
And of course, the whole world trying to understand this thing called Omicron. Giles, what is the research that is being talked about in the UK? In South Africa, only preliminary data, but it may not be as fatal as the previous variants. The good news, it wasn't clear if it would respond to vaccinations or not. Now it seems like it could, and the booster could help. What are you hearing? What are people focusing on in the UK as Omicron spreads?
Well, we've certainly seen a surge of new coronavirus cases in the last few days, and just the number of Omicron cases in particular just rapidly surging. But at this stage, it's just too early to tell really what sort of impact there's going to be in terms of hospitalizations and deaths, because of course there is that sort of 2 or 3 week lag, that 2 or 3 week period between somebody getting infected and then potentially ending up in hospital and potentially dying as a result of getting the coronavirus. In the meantime, the UK government, they're really shifting their focus away from some of these travel restrictions towards more of a domestic focus. The UK Prime Minister Boris Johnson addressed the nation on Sunday here in the United Kingdom, saying that they are going to roll out this massive booster program. They're now offering a booster coronavirus vaccine to everybody in England who is over the age of 18. And according to the latest figures, on Tuesday, more than 510,000 people queued up at vaccination centres all over the country to get their booster dose. So that massive ramping up of the vaccination effort is really starting to get going now. And some in South Africa would envy those lines, some in the US as well. Sherwin, you were talking about not everyone wanting to get vaccinated despite the research. So we are talking live on air in a country where only 35% of people are fully vaccinated. Tell us about the research you've been looking at, an NGO, the Kaiser Family Foundation, looking at the efficacy of vaccines, telling us that they work.
Let me also just touch on the earlier question, Francis. We are hearing that the symptoms that are presenting from Omicron are mild, but we don't know if that's particularly because of the number of people that have been vaccinated in the United States. Over 200 million people have now received 2 shots of this vaccine. So we don't know if the severity of the illness is directly related to the Omicron variant, and certainly going to be for the scientists to come out and pronounce on that. What we are seeing from one of the leading health NGOs in the United States, out of California, the Kaiser Family Foundation, has just released a new study saying that 163,000 deaths could have been prevented in the United States since June had more people been vaccinated. They say COVID-19 remains the 3rd largest leading cause of death in the United States after heart disease and cancer. But just in November, they say 33,000 deaths in the United States, and they estimate that 29,100 of the 33,000 deaths were among unvaccinated people. So the numbers here are clear. What do these numbers tell us, Francis? Yes, there are breakthrough infections. Yes, people can still die even if they are vaccinated. Look at Colin Powell, the former United States Secretary of State, who was double vaxxed, but he was immunocompromised because of a cancer diagnosis. There are various reasons as to why people still die, even though they are vaccinated, but the overwhelming data, the overwhelming evidence points to the fact that if you are vaccinated, you are avoiding hospitalization, and you are avoiding severe illness and likely death. The numbers are clear. They speak for themselves. The facts are out, Francis.
Yeah, an incredible number of deaths there that could have been avoided, sure. All right, thank you very much. Hopefully we can all chat again when there is more information available across 3 continents. Thank you very much. Giles Gibson live for us in London, Sherwin Bryce Pease live for us in New York.